You're with iWITNESS, the Print's daily live feature covering the coronavirus pandemic. I'm Jyoti Malhotra in Delhi, and today I have with me Angana Chakrabarti. She's in Bangalore covering the coronavirus in Karnataka, across the state. Angana, tell me exactly where you are. Are you in Bengaluru? And tell me the situation there.
I've been reporting in Bengaluru for the past week. The situation right now looks a lot better than what it was in the beginning of the month. The cases in the city as well as the state are on a steady decline, and most of the experts that I've spoke to over the course of these past few days said that they hope that in the next 2 weeks there should be an absolute flattening of the curve, at least as far as Bangalore is concerned. Whereas the surge right now, which is mainly happening in the rural areas of several districts like Mysore, Vijayanagar, Belagavi. So these are the districts where the villages are seeing a rise in the number of cases. So that's the situation as it stands right now in Karnataka.
So, have you been traveling in the villages also? Angana, give us a flavor of what you've seen there.
Unfortunately, I've not had the opportunity to visit the villages yet. I will be, reporting from there
Sure.
soon in the coming weeks. So, we'll have to all stay tuned for the
Yes,
reports from
absolutely.
there.
We'll do that definitely. So, viewers, you have a chance to ask Angana all the questions that you want. She will be with us live for the next 20 to 25 minutes. Angana, my other question to you is about, you said that it seems as if the second wave is peaking, infections are down, mortality rates are down. What are experts telling you about this second wave, and is the government preparing for, potentially a third wave?
So I'll just give an overview of what Karnataka has seen in the past month. I've gathered a few numbers here. The surge in the state began around the end of last month. So it was around the 29th to 30th when the number of cases, the state saw the number of cases go from merely hundreds to over 4,000. So there was about 400 on in 1 week, and 2 weeks later there was a tenfold increase to about 4,000. Soon enough, by the first of, sorry, this was around the time of the end of March. So in the beginning, March, April, then we saw the steady rise in cases. By the 1st of May, we were seeing about 37,000 plus cases, across the state. A large chunk of this at that time was focused in Bangalore itself, in the urban center. So the rural areas were just beginning to see a surge at that point, but the large number of cases as well as hospitalizations, there was a tide of hospitalizations around that time
Right.
in and around of Bangalore.
Mhm.
So what we saw as the hospitalizations increase, the number of deaths also likely increase. They in the whole of the state, they were amounting to about over 200, 400 plus. Of course, this is an underestimate, as we have seen from what we have gathered from the other states as well as
Yeah,
Neelam Pandey had earlier come down to Bangalore to
that's
report.
right.
It's an observation she had also made traveling around Hassan and areas of Mandya, which are in the south of Karnataka.
Mhm.
So around that time, I can jump right into what the government had started
Yes, please.
doing.
If you could, that would give us a flavor of what's happening, what the government is doing, how it's handling the situation.
So around May, when the cases were peaking, so the state was registering about nearly 50,000 cases a day. So that was when the BBMP in Bangalore, which is the Municipal Corporation of Bangalore, had moved to adopt this triage system, which we've seen being adopted by the Brihan Mumbai Municipal Corporation. So they essentially took a leaf of their book, and they set up these triage centers. So 28 triage centers were set up in and around Bangalore around after the 11th of May, following an order by the BBMP Commissioner Gaurav Gupta. What these triage centers were essentially made to do was, these COVID patients would have to report, could walk into these triage centers at any point of the day without having to call any of the 108 call centers. And they were checked by the health workers at the triage centers and then transferred to to the hospitals as
Right.
per their need. So as I had mentioned in a previous live about when
Yes.
we were in the COVID ward rooms, this idea of medical triage is basically a protocol by which the patients are allotted beds, that is ICU, oxygen, or a general bed, depending on
Right.
their need for
Yes.
the bed. So that's essentially what Bangalore had also picked up, the BBMP had picked up at that time. For the next few days, what we saw was that the triage centers were more or less, as reported back then, were empty. Not a lot of people were actually going and availing these triage centers.
Mhm.
This was after the 11th of May. So by this time, the cases had peaked. So in my conversations with a few experts yesterday, when I approached this question of why during that time, it took some time for this idea to pick up in the city, and they said that it was because of the nature of the second wave itself. The surge had been rapid, and the decline had also been rapid. It all happened within a month's time. So whatever policy had to be implemented, unless they were implemented within a short span of time,
Right.
the need would just come and go by.
Hmm.
So that was a very big challenge that the city's administration were facing at that time. Adding to this was the fact that they were also running out of test kits. So the rapid antigen test kits, there was also scarcity of rapid antigen test kits around that time.
Mhm.
Members of the technical advisory committee at that time had been pressing the government to acquire more of these testing kits. The number of tests had fallen by 40%. This was around the 16th of May. It had fallen from 1.6 lakh to 1.2 lakh, just when the state was on a downward decline. So the positivity rate was about 40 to 50%. So there was a need to expand this testing. But with this multi-pronged challenge, everything was seemingly in a frenzy. On top of that, hospitals were facing a lack of oxygen. So
Right.
that
So there was
period
lack
from
of oxygen in Bengaluru as well, and we saw
absolutely,
that. Yeah, and we saw that how
absolutely,
that was affecting the capacity of the state to deal with this
yeah.
second wave that came at everybody. It was almost like a tsunami that hit everyone. But Angana, I have a couple of questions for you. The first is actually a viewer called by the name of Santusht Malagi is asking any updates on the lockdown being extended in Bengaluru. Do you have any information?
There has been no concrete information so far, but the BBMP is saying that post 7th of June, that there will be a phased lockdown depending on what the situation, what the COVID cases, the COVID numbers say. And last week, Chief Minister Yediyurappa had also said that, he's likely to move into this phase of unlockdown he gave a rider, though. He said that as long as people behave, people maintain maintain this
Right,
social
right.
distancing protocols, then we can think about moving into this unlockdown phase. So
I suppose the challenge in front of the state is that when you lock down completely, then the economy really takes a nosedive. So I suppose this sort of
absolutely,
every government is dealing with that, right? Whether it's Delhi or
absolutely,
Maharashtra or Karnataka, where you are right now, is between the devil and the deep blue sea. If you don't lock down,
right,
then cases are really surging. If you lock down, then the economy is so badly hurt. But Aman
right.
has a question for you, Angana. He's asking, how hard have Bangaloreans been hit by the oxygen shortage? You just briefly told us about it. And he's also saying that officials, despite Yediyurappa, the Chief Minister's letter to the center, as well as to the High Court, to the Karnataka High Court, Karnataka is still facing a severe oxygen shortfall.
I, as of now, with the decline in number of cases has also meant I'm talking about the current situation. So the decline number of cases meant there is also a decline in the number of the demand for hospital beds, the ICU beds. So right now, Aman, as the situation stands, it's not so bad. But
Okay.
2 weeks back, there was a dire need for oxygen, not just in Bangalore, mind you, even in districts like Chamarajanagar. In fact, there was an incident like the incident we saw in Nashik in Maharashtra, wherein
Right.
24 patients died due to the lack of oxygen in the district hospital. So this is a phenomena that had affected some parts of the state, not just Bangalore. Also, recently, what we saw was that because there's such pressures that these oxygen manufacturers are facing. So this plant in Bellary
Mm.
had there was some technical error. There was some something went faulty with the pipe, and they weren't able to supply that amount of oxygen to the city, which led to a shortfall. So
I see.
so as of now, the city is just recovering in terms of the cases, so we're not seeing that kind of demand. But yes, I mean, the health infra, the in terms of the oxygen, everybody's been through this very, very stressful, very, very hectic time. But experts are hopeful, and so we are hoping that this will only continue now, the decline.
Right. Angana, this is a question from me actually. You wrote this
Okay.
really beautiful piece on the print website, and viewers, I'd urge you to go and read Angana's piece. This is about how when people unfortunately pass away and their pets, in this case dogs, are left completely bereft. And we don't really look at how animals are coping, and we don't know how they're coping. But
Right.
Can you tell us a little bit about your story and about your experience?
So the story really, the idea for the story came from this Instagram post that I came across of this small 5-year-old indie dog. His name is Buddy. So Buddy had lost his 87-year-old parent to COVID last month, and this organization, Let's Live Together, intervened in the situation, were put up these posts saying
So
that
just
we
this
want.
parent was female, male. What
He
was the?
was a male. He was a retired. I'm not. I think a government official. So who was living somewhere around Bangalore. They didn't want to
He was
disclose
taking
too much
care of this
information.
dog. So it was
Was
just
taking
him and
care.
the house and the dog.
Him, I think his wife, and they had a guard. So essentially, when he passed away, his other members of the family had also been afflicted by COVID.
Hmm.
So he had spent about 2 weeks, 2 entire weeks in the hospital. That meant Buddy was at that time chained in the garden with only the gardener looking after him. And he was when Let's Live Together found him, they said that he was in a miserable condition, chained in the garden and absolutely confused. He wasn't eating properly. He was very, very afraid to even being touched. So that's the state in which they had found him in. And with a little coaxing, they were able to get close to him. And finally, because of that social media post, which went viral, they were able to find him a good foster home. So when I met him, he was in his foster house, looking very happy, very chirpy, and absolutely healthy. And he was jumping around when we had gone inside. It was an adorable sight. So he is going to be adopted by someone in Switzerland now. So it's going to be, it's been quite a journey for Buddy, I must say.
So what about Buddy's family? You said the 87-year-old gentleman passed away. What about the rest of the family?
I believe that because he was very close to Buddy, and but nobody else was willing to take care of him, to look after him. So that's why he was in a situation where the organization had to put him up for adoption.
But
So
how did the organization find him? I mean, did somebody call them and say that, look, we are unable to look after our pet, so can you perhaps come and take him or look after him?
so the organization had actually it was that same organization which had first helped with Buddy's adoption when he was a puppy. So
Yes.
they had given Buddy to his previous owner. So when the owner died, then at that point I believe somebody contacted them again and said, now he needs help, or we need you to place him in a foster home. So that's
When
how
they found
it
him,
was.
he was chained up in the backyard,
In the garden, yeah,
in the
essentially.
garden,
Yeah.
and he hadn't been fed for 2 weeks, or what was the
They
situation?
had no idea what he looked, absolutely dire. They had no clue whether he was being fed properly. They just knew that he wasn't eating properly. But he was definitely very, very afraid, so it took them some time to get him, to become comfortable with them. But it wasn't at all the scene I saw when I entered the house. He's such a rambunctious and fun dog. So I'm
Such a
very, very
lovely
happy
story.
for
But
him.
tell me a little bit more. Are this NGO, this pet this pet place that you went? What is the name? Is you said it's called Let's Live Together? Is that what it's
That's
called?
right. That's right. Yeah.
Okay.
They're an
So,
animal
what is
welfare
their
organization.
experience with with animals who are with people and who have been sort of whose parents have perhaps passed on unfortunately because of COVID?
So it's not just them. I also visited Cupa, which is another very big. They run several rescue shelters in Bangalore, and Charlie's Animal Rescue Shelter. They run trauma centers for pets as well, for dogs, for cats,
Right.
street animals, essentially. So all of these organizations said that there are, increasing number of abandoned pets, and what happens is that when the owners, what they're seeing is that the owners don't even come to give them up. Like, they're so embarrassed to face the fact that they aren't able to take care of the pet, that they leave them chained up and in outside the premises of these rescue shelters, or just leave them on some secluded road. So they eventually, these most of these pets are found by chance.
Uh-huh.
So that's what's happening right now, and they're increasingly seeing a lot of these cases, given that deaths have also increased. So that's the situation. Most of the centers,
Right.
the shelters I went to, are absolutely crowded. In one uh, kennel, I've seen about 6 to 10 dogs within a small space. So
Mm.
they're very crowded. The dogs are very happy though. They were very happy.
I suppose families are so bereft and they're not able to cope with
Absolutely.
what's happening with them. But I have a question
Absolutely.
for you, Angana. Shashank is asking this question: is Bengaluru counting a backlog in deaths, and is that why fatalities are so high, even though cases are going down?
So that's another question that I'd pose to the experts, because the curve, is in terms of the deaths we see, are not simultaneous, not parallel to the cases right now, because they still are continuing at a straight line. It's about 240 plus right now.
Mm.
So the experts have said that these are essentially the people who had been infected 2-3 weeks before. So of course they're dying, right? The deaths are occurring right now. So it will take a few more weeks, about 3-4 weeks more, for this curve to fall as well.
Okay. And I have another question for you, Angana, on the Tejasvi Surya case. You remember a few weeks ago how
Yes, yes.
the
Unfortunately, I was in Maharashtra, so I wasn't following up with that, but I'll try my best if.
right. No, I'm just wondering if there's any follow up because although he did say at one point of time that there were 17 Muslim men and that beds were being given away because there was some sort of he was not directly. I don't think he accused anybody, but there was like an indirect sort of reference to these Muslim men, and ultimately it was later found that it was not true. But I think there was so much embarrassment all around. So I was wondering that if you knew about the story and if there was any follow up that was done.
There was, I mean, in the last 2-3 weeks, there has been no update on the case so far, and I believe that he's been maintaining, he's sort of gone back on his word, and
Right.
sort of been maintaining that, I believe there was a list of these names that were floated around. So he kept saying that
Yeah.
no, this list
Right.
is something that came from the officials. Now, who are these officials? We don't know.
Right. Right.
So in a press conference, also several reporters, I remember, had pressed him into, asked him, where did this list
Several
come from?
searching questions. Yes. So there's
Exactly.
another question for you from Jaya, where she's asking: are there any black fungus cases in Bengaluru, and how is the government and state health infrastructure equipped to deal with this?
So yes, I mean, not just in Bangalore, but districts across have seen, a surge in black fungus cases. So around, I believe the black fungus cases till yesterday, as reported by the health minister, Dr. K. Sudhakar, was about 1,200 150. Unfortunately, they're also seeing a shortage of the antifungal medicine used to treat, black fungus. So that's been a major problem right now. So the health department has asked for about 10,000 vials from the center as per now, because as we know that we need to use the about 4 to 5 doses of the injection is to be administered each day to patients who have this black fungus.
Mhm.
But that's a major shortage that the state is seeing right now, and hopefully the center will come through in some time.
Right. Angana, what about the MLAs in Bengaluru or across the state? Well, I mean, you're in Bengaluru right now. When
That's
you
it.
when you go to the hospitals, or when you go to these, well, hospitals really, or cremation grounds or burial grounds, do you see that political, MLAs or other sort of local body people elected to local bodies, are they coming out? Are they helping people? Are they sort of helping them bury their dead or cremate their dead, or just helping, just being there?
So, like I said, I've started reporting from Karnataka in about a week. So my colleague Neelam had covered these stories on cremation grounds as well as hospitals. But what I have seen is that a lot of volunteer groups are, stepping up. There was in fact a very lovely story on how this volunteer group has been helping people cremate their dead. So that essentially this was something that you could see around the first week of May, when the cases had peaked.
Right.
So yes, definitely the BBMP officials are also there on the ground. Another big effort by the BBMP has been to go around and check for monitor the home isolation cases, because Bangalore and several other districts had seen a lot of people die at home while isolating at home. So that kind of mechanism had to be strengthened. So hordes of medical students as well as BBMP officials were going around trying to monitor these home isolation cases to ensure that the patients receive early treatment, and definitely in the triage centers as well as in the crematorium, in order to facilitate the processes, so they you can of course spot the BBMP officials, the Karnataka government officials. Not so much as the MLAs, though, I can assume,
The
but
civil
yeah,
society is basically, pitching in and helping
definitely,
uh, the
definitely.
fellow Bangaloreans. Angana, I think I should let you go now, and it's good to see that you're nicely masked up, even though cases are down. But just be really, really careful, which I'm sure you are. And viewers, thank you so much for watching Eyewitness with Angana Chakrabarti in Bengaluru and me, Jyoti Malhotra in Delhi. Thank you so much for watching.
Thank you.